Who could have predicted that kid would become this guy, the king of the NBA?
Okay, so how did LeBron James, a man of immense talent, fame, and yes, financial resources, find himself on the journey to baldness? This question doesn't just highlight a superstar athlete facing a common issue. It's a deep dive into the world of hair loss, providing insights that might not only help LeBron with his hair loss issues, but also maybe even you, the viewer who happens to be watching this video right now. So, be sure to watch, as I think it would be a great introduction to the condition of male pattern baldness, also known as androgenetic alopecia. And if you're interested in learning more in a less flashy kind of way, the other videos on my channel have the necessary information for you. So be sure to subscribe and check the description for more information. I have a playlist for you that will be ready so it can kind of guide you through this new experience. So without further ado, let's get on with this video.
I mean, they say I'm the best player in the country, and I wanted to keep it that way.
When looking at LeBron James's early years, specifically at ages 17 and 18 during his high school days at St. Vincent St. Mary High School in Akron, Ohio, LeBron sported a dense afro and at times low cuts, showcasing the framing and density of his hair.
LeBron, as you take the court for your first game, how are your nerves tonight?
I got a little nerves in my stomach right now, but once the jump ball starts up, I'll be ready to play.
In 2003, a 19-year-old LeBron James debuted in his first NBA game playing for the Cleveland Cavaliers against the Sacramento Kings. It was here a famous trademark style was noted. LeBron would sport a headband around his hairline. But as the years went on, fans began to notice that the headband was gradually shifting, going towards the back, following the recession of his hairline.
Well, LeBron started NBA. This is where he was when he first came in. Yeah, now it's like right here.
And they also noticed signs of him thinning at the top of his scalp. But look, by 2024, the extent of LeBron James's hair loss issues became apparent to fans and the public. At this point, there was no denying it, making the state of his hair loss very challenging for him to conceal it.
I always say you're the best player in the NBA. It's time for you to come on home, bro. Shave your head. I'm saying that headband.
Now, male pattern baldness, or androgenetic alopecia, its other name, follows a predictable pattern. And in discussions of these types of hair loss conditions, the pattern and its severity exist on a scale known as the Norwood-Hamilton scale. This scale categorizes the various stages of male pattern baldness, providing a framework for understanding hair loss progression. By examining a 2014 Locker interview, we can reasonably note that LeBron James's hairline is around the Norwood 4 to 5 pattern. It should be stated again that male pattern baldness, the pattern of hair loss, is progressive, meaning in most cases, over time, the hairline will continue to recede, the crown may continue to thin out and expand its area of baldness, where ultimately the hairline recession meets the expanding bald crown area to the point where the entirety of the mid-scalp is bald, leaving that classic horseshoe look on the back of the head. Apart from androgenetic alopecia or male pattern baldness, there are other forms of hair loss, such as traction alopecia, which results from prolonged tension on the scalp, pulling at the hair follicles, and also alopecia areata, an autoimmune disease, where the immune system attacks the hair follicles, suppressing their growth. However, the most prevalent form of alopecia is androgenetic alopecia, affecting both males and even females. So, you might ask, is it possible to stop this kind of hair loss? Well, the answer is yes. Pharmaceutical treatments like finasteride, dutasteride, and Minoxidil have been substantiated by high-quality, long-term scientific studies focusing on their safety and efficacy in combating androgenetic alopecia. First, let's have a look at finasteride and dutasteride. These two medications are known as 5-alpha reductase inhibitors, also referred to as blockers, specifically targeting the root cause of male pattern hair loss in androgenetic alopecia. So how does androgenetic alopecia happen, right? We need to know how it happens before we can actually effectively stop it in its tracks. Well, this condition arises when individuals who have the genetics for it, their hair follicles become sensitive to a hormone named dihydrotestosterone, or commonly referred to as DHT. DHT acting in a paracrine manner, meaning it exerts its effects locally where it is produced, unlike endocrine hormones that act on distant areas of the body, leads to the progressive miniaturization of hair follicles. So DHT likes to constrict these sensitive hair follicles, slowly suppressing its ability to grow and produce hair, which results in that patchy, classic, bald appearance at times. DHT is created in the scalp and hair follicle tissues from testosterone combining to that enzyme 5-alpha reductase, which again produces that DHT. So drugs like finasteride and dutasteride block that conversion of testosterone to DHT in the scalp by either finasteride or dutasteride coming into contact with 5-alpha reductase enzymes, binding to them and preventing that conversion. And by using this medication, over time, this causes a reduction in scalp DHT, which has been clinically proven to either stop or reverse hair loss in the majority of men. At the bare minimum, it significantly slows down the rate of hair loss that would otherwise be the natural rate for the individual that uses the medication. Dutasteride, on the other hand, is considered to be a more potent and powerful form of finasteride, as it blocks more of that enzyme, the 5-alpha reductase enzyme that is, making it the preferred choice for increased effectiveness in certain cases. Either medication can be taken by mouth or applied topically to the scalp. However, depending on your country, you would just need a prescription from the doctor to get your hands on this medication. Next up, we have Minoxidil, which is often used with finasteride or dutasteride. Typically, Minoxidil is used as a topical treatment at a 5% concentration, and although its mechanism of action isn't fully understood, it has been observed to unlock certain pathways and channels within the hair follicle cells, causing it to spend more time in the growth phase, also known as the anagen phase of the hair follicle life cycle. But wait, there's actually a catch here. Some people don't have enough of a specific enzyme called the sulforotransferase enzyme, which is important for topical minoxidil to work. And really the only way to know this is if you try it topically yourself for a minimum of 6 months and see no results, or by using genetic tests. People who are non-responders or poor responders might opt to use a higher dose of topical minoxidil than the usual 5%, or switching gears to low-dose oral minoxidil, typically between 0.5 mg to 5 mg. When you take the medication orally, it gets to your liver, and in your liver you have a sufficient amount of that sulforotransferase enzyme. However, there are cardiovascular risks to oral minoxidil, not necessarily topical minoxidil, so you do have to make sure that your heart and your cardiovascular system is healthy, and you have to be using oral minoxidil in the supervision of your doctor, because sometimes it could have some very nasty side effects. You may also want to consider throwing things like topical tretinoin into the mix, because it is known that tretinoin boosts minoxidil's efficacy by increasing the presence of sulforotransferase in the skin. And also, there's evidence that microneedling with tools like the DermaStamp, DermaRoller, or DermaPen can up the ante on how well your skin soaks up the topical minoxidil, turning good results into great ones. In fact, one study saw a 2 times improvement between those that use topical minoxidil with microneedling versus those that just used topical minoxidil alone. However, it is not a good idea to microneedle more than once a week, and the common length for microneedling is 1.5 millimeters. If you microneedle way too frequently, it can actually cause more damage to your scalp and actually hurt your hair follicles, so do this with caution. But I have to say this, whether you're using minoxidil topically or you're taking it by mouth, minoxidil alone cannot target the underlying cause of androgenetic alopecia, and that's DHT. So it's pretty much agreed upon by the skin and hair wizards, actually dermatologists and researchers, that using finasteride or dutasteride at the very least is what you should be doing to combat the underlying cause of androgenetic alopecia, and minoxidil, if anything, is just a boost on top. However, none of these medications are cures. You're still going to have the genetics for androgenetic alopecia. These are just treatments. So if you stop using minoxidil, you may experience a shed. And if you stop using finasteride and or dutasteride, as well as minoxidil, either of these medications, right, you can experience a shed and go back to losing your hair. So this is a long-term commitment, and you should only use it for the rest of your life or however long you want to keep onto your hair.
Waves, bro. That's what I'm saying.
Show the waves, man. I'm here.
Have you ever?
We have all of these solutions to address androgenetic alopecia or male pattern baldness. So why didn't LeBron James pick at least one of these drugs to use? Well, some people like to think it's due to the potential side effects of drugs like finasteride and dutasteride. Finasteride and dutasteride do have side effects that concern libido. However, in the vast majority of men, these side effects go away with continued use. And with all men, given enough time for the drug to leave the body, side effects go away completely. However, those that have anxiety disorders are often advised to seek psychological counseling before starting finasteride or dutasteride. DHT only seems to have its use during male fetal development as well as during puberty. Now, after puberty, the hormone only seems to cause problems as it's primarily associated with conditions like acne, prostate enlargement, and you guessed it, male pattern baldness or androgenetic alopecia. Scientists were able to come to these conclusions after observing populations of humans that lacked this specific enzyme, that 5-alpha-reductase enzyme that I mentioned earlier. The men of these populations were typically more muscular and had full heads of hair. When it comes to sports, some have argued that because DHT is a quote-unquote stronger version of testosterone, that it could help in strength development. Now, if this were true, this could explain why LeBron James probably didn't choose to use finasteride or dutasteride. I mean, well, basketball is a pretty physical sport. However, when you examine where DHT naturally resides in the body, DHT does not stimulate what is known as the musculoskeletal system, and this is a collection of tissues that are responsible for force production and strength. What is responsible, though, is testosterone, and luckily, testosterone doesn't go down when you use things like finasteride or dutasteride. In fact, it goes up marginally, not to something extreme like steroids, but it does increase. And at the end of the day, testosterone is what is operational in the musculoskeletal system, and that is what retains your strength and your muscles. So with all that being said, what is the key issue here? Did LeBron James just not know that finasteride or dutasteride even existed? Okay, maybe he did take it and it didn't work, right? Well, guys, the likely answer here is the fact that the World Anti-Doping Agency, also known as WADA, that oversees all sports over the world to make sure athletes aren't using performance-enhancing drugs to get an unfair advantage, placed a ban on drugs like finasteride and dutasteride, as the agency had concerns that these drugs could be used to hide performance-enhancing drug metabolites during blood work, essentially meaning finasteride could potentially mask the use of things like anabolic steroids. And this ban went into place in 2005 until January 1st of 2009. Now, mind you, finasteride has been on the market since 1997, and during this time, many people have used it to treat their hair loss. But after the World Anti-Doping Agency banned its use, some athletes who were using it to treat their androgenetic alopecia would ultimately be banned from their respective sports. For instance, in 2007, Brazilian League soccer player Romário de Souza Faria had tested positive for using finasteride. He was banned for 120 days. And there are examples like that in other sports. So it's likely that LeBron James did know about finasteride or dutasteride, but if he were to use those drugs, well, he could have been banned from playing in the NBA. So this means that for nearly the whole time LeBron James was playing basketball, he could have used this drug to prevent his hair loss, and we wouldn't have all these memes making fun of his hairline. The thing about finasteride and dutasteride is that when they're used in the earlier stages of hair loss, they can be very, very effective. Remember that Norwood scale that I mentioned earlier? Well, let's bring that back on the screen again. If you're a Norwood 1 to a Norwood 3, finasteride and dutasteride are the most effective. Androgenetic alopecia is a progressive condition of hair loss, which, if not on treatment, may get worse over time and limit the effectiveness of finasteride and dutasteride. I should stress over here, finasteride and dutasteride aren't going to regrow your hair. That is, if there's an area on the scalp that's slick bald, it's not likely that finasteride or dutasteride will help that area's hair come back. That area is likely gone. But all is not lost for our king LeBron James, because now he can easily start taking finasteride or dutasteride because the World Anti-Doping Agency removed finasteride and dutasteride from their ban list on January 1st of 2009. And LeBron James could easily get another hair transplant. And listen to this. As wacky as it may sound from what I'm about to say, they can actually take the hair in LeBron James's beard and place it on top of his head. This could give a better cosmetic appearance to those, well, kind of large bald areas that LeBron has. And this isn't really a wacky idea. It's a common form of hair transplant procedure called body hair to scalp hair transplantation. And surgeons often do this to compensate for a patient's lack of scalp hair. But considering how LeBron James's beard is so robust, I can really see this being a nice solution. So who knows, LeBron, if you're watching this video, maybe you can try this out, and maybe you can, throw me a subscription along the way. But that's it for this video. Did you learn anything new? Be sure to visit the description for more information and in-depth and more scientific videos than the one you're watching right now, so you can probably get more educated in treating this particular condition. Be sure to subscribe and comment below with your thoughts. Anyway, thanks for watching, and I'll see you guys in the next video. Peace out.